Chương trình truyền hình Sống Mạnh do công ty Sống Mạnh thực hiện. Công ty Sống Mạnh là một công ty bất vụ lợi, được thành lập từ năm 2001. Chủ trương của tổ chức Sống Mạnh là đem lại cho người Việt những kiến thức thực tế và chính xác về y tế, sức khỏe, đời sống và gia đình, hầu nâng cao được ý thức bảo vệ sức khỏe và hạnh phúc trong cuộc sống. Liên kết với chúng tôi qua trang mạng songmanh.net, YouTube channel www.youtube.com/songmanh.tv hoặc email cho chúng tôi tại contact@songmanh.net. Đây là chương trình Sống Mạnh, được phát hình hàng tuần vào lúc 7 giờ 30 phút tối thứ 6 hàng tuần và sẽ được phát lại vào lúc 4 giờ chiều hôm sau trên đài truyền hình Nét Việt và sẽ được lên YouTube channel sau đó qua băng tần của Nét Việt YouTube để quý khán giả tiện theo dõi. Chương trình Sống Mạnh TV hàng tuần sẽ có những tiết mục định kỳ sau đây: tin tức y khoa sống mạnh, sống sao cho mạnh với bác sĩ Trịnh Ngọc Huy và những tiết mục văn nghệ có tên Sống Mạnh với âm nhạc. Hôm nay, chương trình Sống Mạnh TV sẽ được bắt đầu với tiết mục Sống Mạnh với âm nhạc với những nghệ sĩ có tiếng hát và những bài hát gần gũi với tâm tình của quý vị. Xin mời quý vị cùng nghe.
Hà Nội mùa này vắng những cơn mưa, cái rét đầu đông khăn em bay hiu hiu gió lạnh. Hoa sữa thôi rơi ta bên nhau một chiều tan lớp, đường cổ ngữ xưa chậm chậm bước ta về. Hà Nội mùa này chiều không buông nắng, phố vắng nghiêng nghiêng cành cây khô, quán cóc liêu xiêu một câu thơ. Hồ Tây tím mờ. Hà Nội mùa này lòng bao nỗi nhớ, ta nhớ đêm nào lạnh đôi tay, hơi ấm trao em tuổi thơ ngây, tượng như còn đây. Hà Nội mùa này vắng những cơn mưa, cái rét đầu đông khăn em bay hiu hiu gió lạnh. Hoa sữa thôi rơi ta bên nhau một chiều tan lớp, đường cũ ngữ xưa chậm chậm bước ta về. Hà Nội mùa này chiều không buông nắng, phố vắng nghiêng nghiêng cành cây khô, quán cóc liêu xiêu một câu thơ. Hồ Tây tím mờ. Hà Nội mùa này lòng bao nỗi nhớ, ta nhớ đêm nào lạnh đôi tay, hơi ấm trao em tuổi thơ ngây, tượng như còn đây. Hà Nội mùa này chiều không buông nắng, phố vắng nghiêng nghiêng cành cây khô, quán cóc liêu xiêu một câu thơ. Hồ Tây tím mờ. Hà bao nỗi nhớ. Ta nhớ đêm nào lạnh đôi tay, hơi ấm trao em tuổi thơ ngây, tưởng như còn đây.
Tiết mục tiếp theo của Sống Mạnh sẽ là một trong những tiết mục chính quý vị khó có thể bỏ qua với bác sĩ Trịnh Ngọc Huy.
Xin chào quý vị, đây là chương trình Sống Sao Cho Mạnh với bác sĩ Trịnh Ngọc Huy và Phạm Phong Nam. Hôm nay chúng tôi được nói chuyện một đề tài rất là đặc biệt, đó là vấn đề sản phụ khoa cùng với bác sĩ Trịnh Elyse Vyvy. Thưa quý vị, bác sĩ Trịnh Elyse Vyvy tốt nghiệp Đại học Y khoa tại Brown University và sau đó đã tu nghiệp về sản phụ khoa tại Kaiser ở Santa Clara. Vì hiện nay bác sĩ Vyvy hiện đang hành nghề tại Providence, chuyên ngành về sản phụ khoa. Xin kính chào bác sĩ Vyvy.
Xin chào tất cả mọi người. Today, my presentation is called Pregnancy Do's and Don'ts. I'm going to share my screen and I'll try to speak slowly so that we can have the live translation into Vietnamese. I apologize that my Vietnamese is not good enough to speak the whole presentation in Vietnamese. So I will begin. Okay, so pregnancy is a time when women get bombarded with all kinds of advice from social media, friends, and family, and it can be really overwhelming. Oftentimes, women are told that they can't do something or that they must do something. And a lot of times this advice is not based in real research and evidence. So the objective of today's presentation is to look at evidence-based reviews of do's and don'ts in pregnancy. This comes from advice from the American College of Obstetrics and Gynecology. We will be reviewing some of these common topics. So starting with prenatal vitamins. That's the first thing when you get pregnant, someone will tell you, hey, you need to take prenatal vitamins. But what is in prenatal vitamins? Really, there's three main ingredients that are the most important, and that's folic acid, vitamin D, and iron. What is folic acid? So folic acid comes from folate, which is a natural mineral found in a lot of foods. In pregnancy, it's important that we make sure we're taking in enough folate or folic acid because it's very important for the formation of the baby's brain and spinal cord. So there's lots of prenatal vitamins out there. It's important to look at the label on the back and make sure that you are getting 400 to 800 micrograms in that vitamin. I would say it's the most important ingredient in prenatal vitamins. Sometimes women have a lot of nausea and vomiting in pregnancy and can't tolerate the full prenatal vitamin, in which case I usually recommend people take just a folic acid supplement because really that's the most important thing.
Bác sĩ Vyvy, theo kinh nghiệm của tôi biết thì cái folic acid nó không có nhiều trong các thức ăn. Thành ra như khi những phụ nữ có bào thai thường họ phải để ý và uống thêm cái folic acid này, đúng không? That means they had to drink extra folic acid because it's not very common in a lot of our diet.
Yes, that is correct. We have to increase our usual amount. We have to supplement what's in the regular diet. Now, if somebody, oftentimes if somebody has a very well-balanced diet, lots of dark leafy greens, beans, and some of the things that you see here, you are probably getting enough folic acid, but it's hard to be sure, and it's hard to keep track. And so for that's why we recommend everybody just take the supplement to be sure. The other important ingredient in a prenatal vitamin is vitamin D. When you are deficient with vitamin D, studies have shown that that has an increased risk of certain complications of pregnancy, including preterm birth and preeclampsia, which means high blood pressure in pregnancy. We don't recommend testing it for a vitamin D deficiency. We just recommend that everybody take it. And most prenatal vitamins have the amounts of vitamin D you need. Lastly, the other most important ingredient in prenatal vitamins is iron. This is important because iron is needed to build up our blood stores. And in prenatal care, it is very standard to test for anemia at the beginning of pregnancy. So your doctor will usually order some blood work, and one of that blood is looking for anemia. The reason why it's really important to have enough iron and to have enough blood is because our body is preparing to give birth at the end of pregnancy, and that is a time of a high risk for losing lots of blood. So our bodies are creating extra blood, getting us ready for that, and iron is an important part of that. For those who have a well-balanced diet with lots of lean proteins and leafy greens, you don't necessarily need an extra iron supplement, and most of the time the iron that's in the prenatal vitamin is sufficient. Here are some common foods that are very rich in iron. So certain cereals, beef, shellfish, and a long list of other foods. But if you find that this is not a common part of your diet, or you're having a lot of food intolerance in pregnancy, that's when it's important to go ahead and just take a supplement. And that's why we recommend prenatal vitamins in pregnancy, to standardize our intake of these important nutrients. Calcium is also important in pregnancy, but it's important to note that most multivitamins do not have sufficient calcium. So in addition to the vitamin, you should be making sure you're drinking milk or eating cheese or eating soybeans or taking a calcium supplement to make sure you're getting enough calcium in your diet. Okay, the next topic is about weight gain. This is a big topic in pregnancy. A lot of people, when they get pregnant, might think that they are supposed to gain a certain amount of weight and might or get worried if they're not gaining enough weight. So this is a moment to take a look at the evidence. What is recommended weight gain? So the amount of weight that it is recommended to gain in pregnancy depends on your starting weight. So for women who are underweight to begin with, which means a BMI of less than 18.5, we recommend 30 to 40 pounds. On the other end of the spectrum, for women who have obesity to start with and have a BMI of 30 or greater, the recommended weight gain is less, so 11 to 20 pounds. Why is weight gain important? So weight gain that's below the recommendation is associated with a higher risk of preterm birth and very small babies or babies with low birth weight. On the other hand, weight gain above the recommended level increases your risk of needing a C-section or of the baby being very large and therefore having delivery complications. In general, women should be listening to their bodies, eating well-balanced diets. When they're hungry, we should eat in pregnancy. It's not really about eating for two, so you don't take the normal amount you eat and eat twice as much. For the most part, throughout pregnancy, people's diets should increase just a little bit. So eating 350 to 450 additional calories per day. That being said, everybody's body is different, their metabolism and activity level. So this is not a hard and fast recommendation, but just a general recommendation. myplate.gov is a great resource on nutrition that I recommend for everybody in pregnancy and otherwise. How about alcohol? So I think it's lately, people might be hearing different recommendations about alcohol. I think historically we've all been told don't drink any alcohol, and some people might hear that a little bit is okay. So my goal here is to clarify what is the reality. And basically, we know for sure that high alcohol intake is dangerous for a developing fetus and is associated with fetal malformations and developmental delay. But how about low to moderate alcohol intake? There are some studies that show that low to moderate alcohol intake is not associated with fetal malformations. However, the truth is that this is a very, very hard thing to study. There are not any trials any scientific studies that deliberately expose women to different levels of alcohol and look at the outcomes. So we cannot conclude a safe level of alcohol in pregnancy, and therefore all major health organizations recommend abstaining completely from alcohol during pregnancy. This one's a quick one. Artificial sweeteners like stevia, sweet and low, Splenda, all of those are safe in pregnancy, which is great. Caffeine. This is another topic that can feel controversial. It is very common for a woman to get pregnant and to be seen drinking a cup of coffee. And a lot of people tell her, can you really drink that in pregnancy? And I'm here to illuminate the truth. So low to moderate caffeine intake is safe in pregnancy. What does that mean? That means 300 milligrams per day. So what is 300 milligrams? So the average cup of brewed American coffee is 130 milligrams of caffeine, approximately. A café soda, so a strong Vietnamese coffee, has a lot more caffeine, and it has almost 300. So 1 per day is the limit that would be recommended in pregnancy. I've listed a few other common drinks, including tea, which has less caffeine, only about 50, in an 8-ounce cup, 16 and 100 in a 16-ounce cup, and then a soda has about 50. So all that to say, one caffeinated drink, 1 to 2 caffeinated drinks per day is probably okay, unless it's a strong Vietnamese coffee, then only 1 per day. And then we're going to review fish and other foods next. So eating fish in pregnancy is associated with improved brain development in children. Scientists believe that this is because fish is very rich in omega-3 fatty acids, which is an important nutrient. However, the fish that are found and are fished from our oceans can also be a source of mercury exposure. Mercury is an element that can be poisonous to us in high quantities and can be damaging to the developing fetal brain. So the best fish to eat are fish that we know do not have a lot of mercury. I've listed some here. And then there's also fish that I think are the most common ones are salmon, sardines, trout. And then here is a list of fish as well that are not necessarily full of omega-3 fatty acids, but we know they're safe. Then there are some fish that unfortunately do have high mercury. In general, these are going to be really large fish. So some of these examples are tuna, swordfish. So those would be best to not avoid completely, but limit it to maybe about 1 serving per week. And some people ask me, hey, doctor, what about sushi? And there's a pretty strong belief out there that sushi should be avoided in pregnancy. The reality is that the main concern about avoiding sushi is avoiding food poisoning and foodborne illness. But in the United States and in developed countries, the risk of infection from sushi is not significant and is quite rare. So I always tell my patients, you are welcome to eat sushi. Other foods to avoid are other foods in which the risk of infection is higher. So raw and undercooked red meat should be avoided. Fruits and vegetables should be thoroughly washed. We used to say avoid deli meats, like ham and turkey that can be found at a sandwich store. But that is outdated advice. That comes from the fact that in the 1990s, the bacteria Listeria was most commonly associated with deli meats. But these days, Listeria outbreaks can come from all kinds of products and are hard to predict. So better advice is to pay attention to your local news and pay attention to local outbreaks. And in general, ordering deli meats from a reputable deli, a reputable restaurant that maintains appropriate hygiene is probably safe.
So, Dr. Vyvy, is it still safe if we eat, in this case, like well-cooked food instead of raw food to avoid listeria?
Yes.
I know it's uncommon. Okay.
Yeah. And something folks will do is if you go to your deli, so for example, you go to order a banh mi at a store, you can ask them to microwave the meat for 10 to 15 seconds, and that can add an extra layer of caution to avoid listeria and other foodborne illnesses. So the next section is on smoking, nicotine, vaping, and marijuana. We know for sure the evidence is very clear that smoking is bad for mom and bad for baby. You know, in general, in terms of smoking, it's increased risk of lung cancer, oral cancer, all kinds of cardiovascular risks. But in pregnancy specifically, it's also associated with miscarriage, placental abruption, which is very significant bleeding in pregnancy, preterm birth, low birth weight, and stillbirth. And so when someone becomes pregnant and is a smoker, this is a really wonderful time to strongly consider and begin the effort to quit. And a lot of products are available to help people quit. And even though these contain nicotine, these are overall safe in pregnancy, and the benefits of using them to help somebody quit outweigh the risks. So Nicorette gum, patches, as well as some of these oral medications are all safe in pregnancy. And I would encourage pregnant women who are who are smokers to talk to their doctors about getting some of these products to help them quit.
Maybe I think one the issue with a number of Vietnamese women is secondhand smoking. There's a lot of Vietnamese men smoke at home in Vietnam, and I think the way we live in Vietnam, mình sống chung đụng với nhau, so the Vietnamese women who are pregnant, they may have been exposed to the husband who smoke. So I think that was one issue. Even though I think that issue become less and less nowadays with more knowledge of men about smoking affecting their health and the baby's health.
I think that's a really good point, and I hope that in such families, the pregnancy is an opportunity for everybody in the family to change their lifestyle. So absolutely, secondhand smoke carries all the same risks as smoking. These days, vaping and electronic cigarettes are very common, and a lot of times electronic cigarettes and vapes are marketed as less harmful cigarettes because they don't have as much smoke. And for some people, they can effectively be used as a path towards quitting nicotine altogether. However, for a lot of electronic cigarettes and vapes, even though there isn't smoke, the delivery of the amount of nicotine is actually quite high, and the effects of pregnancy are unknown. And so we do recommend avoiding electronic cigarettes and vaping in pregnancy as well. Moving on to exercise and bed rest. So oftentimes women will be cautioned to not exercise and to not move too much when they're carrying the baby. And I understand this impulse. You're worried about shaking the baby or harming the baby. But in reality, exercise is definitely safe in pregnancy and very much encouraged. We recommend 20 to 30 minutes of moderate intensity exercise 4 to 5 times per week. Sometimes women will hear advice about limiting their heart rate to a certain level, but there is not evidence to support that. And in general, we recommend that people maintain whatever exercise they were doing before, or maybe if before pregnancy you weren't exercising a lot, this is a time to introduce walking or maybe to slowly build up to jogging, but it is not the time to start something brand new. So if you were not a marathon runner before, pregnancy is not the time to start, but it is a good time to maintain what you were doing before, and maybe a good time to introduce some slightly more, some new good habits. We do recommend avoiding contact sports, so skiing and horseback riding as well. So sports that are high risk for injury. Historically, a lot of doctors used to tell women, especially women who have higher risk pregnancies, to have bed rest. I won't say that bed rest is never recommended. There are some very rare situations where your doctor will strongly recommend bed rest, but for the vast majority of pregnancies, bed rest does not help avoid complications and is associated with extra risks, including blood clots, muscle wasting, and it is not shown to reduce the risk of preterm birth or pregnancy loss. So the general advice to women is stay active, stay out there, keep doing what you're doing, go to the park with your family. Staying active rather than being overly cautious or overly sedentary is definitely a healthier approach to pregnancy.
So the common myth among a lot of a woman is try not to exercise too much so they avoid contraction. If they do a lot more exercise, they increase more contraction, with that called pregnancy to them. And also a common myth is that try not to just to rest, not to eat too much, not to be too active, so you can gain more weight. I think that is quite a common myth among the Vietnamese when I was young. So what is your comments? Yes.
Oh, that's such a good question. And I'll get a little bit personal. I am currently 31 weeks pregnant, and I was recently at a family event. I was dancing at my sister's wedding, and a family friend came up to me and said, "What are you doing? There's a baby in there." And I understand that that tradition has a lot of old roots. So pregnancy is 9 months long, 9 to 10 months. That is a long time to be avoiding all the things that we know are really good for you. You know, weight-bearing exercise, cardiovascular exercise. And in reality, at the end of pregnancy is labor. And I would say labor is the most intense athletic event of most women's lives. So this, I would actually say pregnancy is a really important time to maintain basic fitness. Again, if you aren't an intense extreme athlete at baseline, this is not the time to start, but it is a time to maintain basic cardiovascular health, strength. For women who like to weight lift or maintain their strength, back muscles and leg muscles are really important in pushing and when it comes to labor and delivery. So something to think about. And in terms of gaining weight, we did review towards the beginning of the presentation good weight goals. So for a woman of average weight, in general, we're looking at about 25 to 30 pounds. That weight gain tends to happen just by living your life and eating, eating a well-balanced diet, breakfast, lunch, and dinner, some healthy snacks in between, listening to your body, following your appetite. In general, for the average pregnancy, you don't have to be deliberately eating excessively to meet those weight goals. That weight goal is going to happen regardless. So that's what I would say. Okay, so oral health. A lot of people wonder if dental health and dental procedures are safe in pregnancy. This is pretty well studied, and routine dental procedures should continue. That includes cleanings, extractions, scaling, root canal restorations, and fillings. Sometimes the dentist will recommend antibiotics. Dentists usually communicate with doctors to make sure that they are giving safe antibiotics in pregnancy, but there's a lot of, the vast majority of antibiotics that are used in dentistry are safe in pregnancy. And of course, in everybody, but especially in pregnancy, dentists should be using the shield to protect the abdomen and thyroid from radiation when taking x-rays. Hot tubs and swimming. So hot tubs, there is actually pretty good evidence that in the first trimester, hot tubs should be avoided because there is an increased risk of miscarriage. And that is essentially when the internal body temperature is above 101 for a sustained 101 degrees Fahrenheit for a sustained period of time. That the first trimester is the time in pregnancy when the baby's organs are being formed. And so it's a very critical time. So we typically say avoiding hot tub use before 20 weeks, but swimming pools are okay. Insect repellents are safe in pregnancy and are encouraged for areas that have high rates of Zika, which I will talk a little bit about again later. Hair dyes. So dyeing your hair is safe in pregnancy, in general, for the average individual who's just going to get it done once or twice in pregnancy. A lot of women in the Vietnamese community are cosmetologists and are exposed every day to a lot of the chemicals in the workplace. This is an area that is very difficult to study. But in general, there should be workplace guidelines about the types of protective personal equipment that all cosmetologists should be wearing. And that is true for somebody who is working in this field, who is pregnant as well. But unfortunately, we do not have specific recommendations to give. I think this is an area that we could still use more information and data, but following general workplace safety standards is important for everybody, including pregnant people. Travel. So airline travel is safe in pregnancy. If you're going on a long flight, definitely recommend you take that aisle seat if you can, and take a couple walks up and down the aisle just to reduce the risk of blood clots. A pregnant woman's risk of developing blood clots is a little bit higher than somebody who's not pregnant. The radiation from the flight and from security is minimal and does not pose an excessive risk in pregnancy. Another thing to think about is looking up the Zika rates. If your destination is an international destination, and the CDC is a great place to do this, the CDC website. I think I forgot to mention that a lot of people ask, Doc, when is the latest I can travel? And most people will recommend not traveling after 36 weeks of pregnancy. Some airlines will even require a doctor's note for somebody who looks very far along in pregnancy to clear one for travel, although that depends on individual situations. And the thought behind that is just wanting to reduce the risk of accidentally going into labor while you're on a flight. But other than that, in general, for the average pregnancy, airline travel is safe. And then moving on to sex in pregnancy. So sexual intercourse and orgasm are safe in pregnancy. Sometimes after sex, that can be associated with feeling some mild cramping in someone's pelvis. And that, of course, can be very distressing, but it is safe in pregnancy and has not actually been shown to lead to true preterm labor. Of course, if those symptoms are distressing, it's a personal decision that everybody needs to make for themselves. I also forgot that Dr. Trinh, you did earlier ask about the cramping that happens with exercise, and I should address that. So the uterus, the womb where the baby is, the uterus is a muscle like any other muscle. So if a muscle is dehydrated and overworked, it will cramp just like your legs will cramp. So even though exercise, it is important, it is also really important to stay very well hydrated, drinking lots of water, even more water than one would outside of pregnancy, and considering drinking electrolytes like Gatorade. But in general, mild cramps in the setting of dehydration do not usually lead to true preterm labor. Back to sexual intercourse in pregnancy, there are specific situations in which that should be avoided, which includes if you're having vaginal bleeding throughout your pregnancy, if your bag of water is broken, or if you have a particular diagnosis called placenta previa, which is where the placenta is at the front of the uterus near the cervix, which could potentially be affected during sex. And so in that situation, your doctor will advise you to avoid sex throughout pregnancy. So in conclusion, my goal was to review some common myths and truths in pregnancy and to just address the fact that pregnancy is a time that for many people is really exciting, but also full of a lot of unknowns, and people can receive a lot of advice. So I am hoping to ground this advice in evidence and in the scientific studies that guide what we know about pregnancy. And I hope this has been useful to anybody who is pregnant or considering pregnancy or has a loved one who you hope to advise in having a healthy pregnancy. Thank you very much.
Cảm ơn bác sĩ Trịnh Vyvy đã chia sẻ cùng với quý vị chương trình Sống Mạnh với bác sĩ Trịnh Huy và Phạm Phương Nam hôm nay, không những về những việc làm riêng của mình mà ngay cả vấn đề cá nhân của mình. Bác sĩ Vyvy cũng nói rằng là có 31 tuần có bầu rồi phải không? Dạ. Bác sĩ Vyvy khoảng còn độ 5-6 tuần nữa là sinh con, đứa con đầu tiên của mình phải không?
Yeah.
Chắc cảm ơn quý vị, các bác sĩ Vyvy đã tới nói chuyện cùng với chúng tôi ngày hôm nay. Chắc đa số quý vị cũng đoán được rằng bác sĩ Trịnh Elyse Vyvy là con gái thứ hai của tôi, chuyên về sản phụ khoa và hiện nay đang làm ở tại Providence trên Rhode Island. Xin cảm ơn bác sĩ Vyvy. Xin kính chào bác sĩ Vyvy.
Okay. Thank you everybody.
Và bây giờ mời quý vị trở lại với chương trình ca nhạc Sống Mạnh.
Từ kiếp nào ta ngỡ bơ vơ, người ân tình sao nỡ xa ta. Từ kiếp nào tình nỡ tình sâu, và lòng thì nỡ lòng buồn, lòng ngỡ lòng buồn, vì lòng tìm mãi tình nồng, tìm mãi tình hồng, mà tình thì mãi mịt mùng. Ai đi tìm ai suốt đời, ai đi tìm ai suốt đời. Tình yêu nào như đến trong mơ, tình yêu nào êm ái như thơ, tình yêu nào lòng cứ đợi chờ từng phút từng giờ, từng phút từng giờ, mà tình thì đến nào ngờ, tình đến nào ngờ, và tình nào có hẹn giờ. Em đi tìm anh suốt đời, em đi tìm anh suốt đời. Đời em đó chết theo ngày buồn, buồn lẻ loi thấy đâu niềm vui. Niềm vui đó xót xa đợi chờ, chứ đã tới với tình anh cho. Tình yêu này em nhớ ơn anh, tình yêu này em nhớ ơn thêm. Tình yêu này tình quá ngọt ngào, và tình còn quá tràn đầy, tình quá tràn đầy, làm lòng cảm thấy nghẹn lời, lòng thấy nghẹn lời, vì tình hồng rực rỡ một trời. em tôn thờ anh suốt đời, em tôn thờ anh suốt đời. Tình yêu nào như đến trong mơ, tình yêu nào êm ái như thơ, tình yêu nào lòng cứ đợi chờ từng phút từng giờ mà tình thì đến nào ngờ, tình đến nào ngờ, vì tình nào có hẹn giờ. Em đi tìm anh suốt đời, em đi tìm anh suốt đời. Đời em ngỡ chết theo ngày buồn lẻ loi, thấy đâu niềm vui đó xót xa đợi chờ, chứ đã tới với tình anh cho. Tình yêu này em nhớ ơn anh, tình yêu này em nhớ ơn thêm, tình yêu này tình quá ngọt ngào, vì tình còn quá tràn đầy, tình quá tràn đầy, làm lòng cảm thấy nghẹn lời, lòng thấy nghẹn lời, vì tình hồng rực rỡ một trời. Em tôn thờ anh suốt đời, em tôn thờ anh suốt đời. Tình yêu này, tình yêu này, tình yêu này em nhớ ơn ai.
Đường xa ước mơ. Đêm nay thời gian đứng yên lắng đông, cho đôi tình nhân đắm trong giấc mộng. Mưa rơi làm thêm khó câu giá từ, vì đường xa ước mơ. Da em lùa lá, tóc em xóa mềm, lung linh trời sao sắc trong mắt em. Môi em làm thêm khó câu giá từ, vì đường xa ước mơ. Ngày đường xa ước mơ, em muốn anh đưa em về. Sao em không ở lại đây đêm nay, vì đường xa ước mơ, đừng bắt anh đưa em về. Anh xin em đừng về vì đường quá xa xôi. Xin mưa chỉ mỉa mai không lắng đông, cho đôi tình nhân đuối trong giấc mộng. Trong cơn ngủ quên trốn câu giá từ, vì đường xa ướt mưa. Ngày đường xa ướt mưa, em muốn anh đưa em về. Sao em không ở lại đây đêm nay? Vì đường xa ướt mưa, đừng bắt anh đưa em về. Anh xin em đừng về vì đường quá xa xôi. Xin mưa chỉ mỉa mai không lắng đông, cho đôi tình nhân đuối trong giấc mộng. Trong cơn ngủ quên chốt câu giá từ, vì đường xa ướt mưa, đường xa ướt mưa. Đường xa ướt mưa, vì đường xa ướt mưa. Đường xa, vì đường xa ướt mưa.
Blue Spanish eyes, teardrops are falling from the Spanish eyes. Please don't cry. This is just adios and not goodbye. Soon I'll return, bringing you all the love your heart can hold. Please say, say you and your Spanish eyes will wait for me. Soon I return, bringing you all the love your heart can hold. Please say you and your Spanish eyes will wait for me. Amor, amor, amor. This is how I say the lovely way how much I love you. Amor, amor, my love. And every day and every night I'm thinking of you. I can't find another words with meaning so clear. My lips try to whisper sweeter things in your ears. Somehow or the other nothing comes quite so dear as this soft caressing word I know. Amor, amor, amor. When you're away, there is no day, night so lonely. Amor, amor, my love. Make life divine, say you be mine and love me only. Do you? My heart cries out perfidia, for I found you the love of my life in somebody else's arms. Your eyes are echoing perfidia, forgetful of the promise of love, you're sharing another's charms. With the sad lament, my dreams have faded like a broken melody. While the gods of love look down and laugh at what romantic fool we mortals be. And now I know my love is not for you, and so I take it back with a sigh, perfidious one goodbye. And now I know my love is not for you, and so I'll take it back with a sigh, perfidious one, goodbye, goodbye, perfidious as one, goodbye, goodbye.
Chương trình truyền hình Sống Mạnh do công ty Sống Mạnh thực hiện. Công ty Sống Mạnh là một công ty bất vụ lợi, được thành lập từ năm 2001. Chủ trương của tổ chức Sống Mạnh là đem lại cho người Việt những kiến thức thực tế và chính xác về y tế, sức khỏe, đời sống và gia đình, hầu nâng cao được ý thức bảo vệ sức khỏe và hạnh phúc trong cuộc sống. Liên kết với chúng tôi qua trang mạng songmanh.net, YouTube channel www.youtube.com/@songmanh.tv hoặc email cho chúng tôi tại contact@songmanh.net.